Awesome. So hi, everyone. Welcome to our webinar this afternoon. My name is Lori Salazar, and I'm the Associate Director for the Center for Student Involvement. And thank you for coming to our session today. At any time, if you have a question, feel free to put it in the chat and we'll make sure we answer it. And then we can also answer it at the end of our presentation as well. For now, if you can just keep yourself on mute and wait until the Q&A portion, and then at that point, you can definitely unmute yourself or raise your hand and we can get that question answered. So we're going to get started with our presentation, and I'm going to kick it off to our Cowell Center team here. So you have the floor now.
Hi, my name is Kristen Tappan, and I am one of our therapists in residence over at CAPS, which is our counseling center housed within the Cowell Center. I'm also an alum. I graduated from Santa Clara in 2011 with my bachelor's in psych, and then again in 2017 with my master's in counseling psych and a marriage and family therapy emphasis. Today I have Larissa and Tammy also from the health center joining me.
Hello, my name is Tammy. I am the health insurance coordinator here at the Cowell Center, and I deal with all things regarding the student health insurance plan.
Good afternoon. My name is Larissa Davis. I'm a medical assistant here in the student health services side at the Cowell Center.
Great. Give me just one moment to share my screen so we can all view the presentation. I'm having a technical difficulty. Can you all see the presentation?
It just shows right now a loading screen.
Okay. Let's see. Yeah.
There we go.
Okay, great. All righty, let me minimize this. So the Cowell Center is the comprehensive health care provider for the SCU student community. We are committed to caring for the whole person by providing professional, medical, and psychological services through compassionate treatment and education. We're going to start with the student health services side. Larissa?
Larissa, you're muted.
I am muted. Hi, everyone. Welcome again to this webinar to talk about the services that we can help provide to your student when they're here on campus. So here in the Cowell Center, we have a medical side. It's known as Student Health Services. And on that, within that group, we have a full medical staff. We have our campus physician, Dr. Osofsky, Pat McBride, who's our physician's assistant, Alana Conrad, who's our clinical nurse practitioner. We have Laurel Hess, registered nurse, and myself, I'm a medical assistant and phlebotomist. We are also in the process right now of onboarding another full-time RN. All these folks are here to deliver medical services to your students on site here at campus. We're open from, we see patients from 9 a.m. to 5 p.m. Monday through Friday. So what's wonderful about having the Cowell Center right here on campus is, as most of your students will be joining us as residents, if they wake up with a sore throat or they have a hurt ear or what have you, there's a place right here where they can seek care. I'll tell you, they can book online, but the best way is still to call in and speak with someone on the phone. And we do offer appointments for like routine situations that students might find themselves in, as well as injury or illness, say they take a fall or roll an ankle. We do have an in-house pharmacy with a large selection of very fairly priced generic medication available for students. We run lab tests here, immunizations. We do have a registered dietitian within our center as well, where we can refer students. And then we also do work with students who might need a higher level of care. Say they come in with something that does need a specialist. We're able to communicate with providers within our community locally to help those students. We really do this is part of their education here at Santa Clara, is advocating for themselves and figuring out their healthcare. And we really want to be a really safe and accessible place for students. So again, they can call on the phone, they can speak to one of our wonderful, friendly, and informative receptionists. There's same-day appointments available based on availability, and then also based on need. We do run as sort of an urgent care model. If a student does call and has something that's more critical that needs to be seen today, we do secure appointment slots in the morning for those appointments. So we look forward to being here as a resource for your students and walking alongside them as they learn how to navigate, making their own medical appointments and walking through their healthcare. So it's a privilege to serve this community, and welcome to Santa Clara.
Tammy?
Okay, I did not. So for incoming students, we do require immunization records to be submitted. So all incoming students must go to their SCU portal to access the Cowell Center My Health portal and complete the following: personal medical history, immunization records, that was due August 1st, and if applicable, the medical immunization exemption form. So the immunization policy is for all newly enrolled graduate and undergraduate students, including transfers and admits. So all students are required to be fully vaccinated and up to date for COVID, including boosters per eligibility. You can find this more information at the website. Deadline was August 1st, but if you haven't done so, please get those in. If you could not get a vaccine for a medical reason, please have your physician complete the medical immunization exemption form. And after our medical services, there is a nurse advice line as listed there. There's also a list of urgent care and local hospitals available at the Cowell website. We also have a box right outside the Cowell Center with urgent care. So if the student walks by our office, finds out it's closed, they could also get that list. And SCU's emergency services are available when the Cowell Center is closed, and they can access that by calling campus safety at the number below. So we're going to go to the most exciting part of this presentation. Just kidding. So we're going to talk about health insurance. So students enrolled domestic students enrolled half-time or more are required to have health insurance. So that is 6 units for undergrads. Unless you're an F1 student, then there are certain other restrictions in order to get the health insurance waiver. But it's 6 units or more undergrad students. And F1 students enrolled in 1 unit or more, excuse me, will need to have health insurance. So that's just there. So just a little note on how the, pardon me. So the Cowell Center does not bill insurance. So that includes students that have the student health insurance plan at Cowell, and also the students that have the private insurance. Pardon me. All services received at the Cowell Center will be billed to the student's account and the SU student account, and then they will be responsible for paying that by the deadline. If you would like your health insurance company to reimburse that, you would have to submit a claim. And you could get a walkout statement from our office. Sorry, pardon me. So questions about health insurance can be referred to me right below at the email you can see. CAP services are free, but student medical services are subject to fees. Next slide. Pardon me. So the health insurance waiver must be completed every academic year. And the online health insurance waiver form is available by clicking on the Gallagher tile in their My SCU portal. And then they will go to that will lead you to a link on the Gallagher website. Once you've gotten to the Gallagher website, you will click on log in. And once you have login, what will happen is your Duo, so you actually need your Duo enabled in order to be able to access the health insurance. But once you click on log in, then as soon as that happens, the Duo app on your student's phone will go ding, and then you will have to press either yes or no to enter. F1 students are required to enroll in the university-sponsored health insurance plan unless they are dependent on a US-based Affordable Care Act compliant plan. So say your student is an F1 student and they have insurance through you, and you work for a company in the US and the plan is underwritten in the US, then they can submit a waiver with that information. The cost of the health insurance is not covered in the tuition, and it actually shows up as a separate line item in your on your bill. So bills did go out today. So if you haven't submitted the health insurance waiver and you want to opt out, then the health insurance charge will be on your bill. Next item, please. So we do verify all health insurance questions. Health insurance waivers. So we will go, once your student has submitted the waiver, what will happen is we will run it through our system and see that the waiver, that the health insurance is actually currently active. If Gallagher is not able to verify that your health insurance is active, then you will get one of the following status emails, which is either the waiver is denied because your insurance company told us the coverage is no longer active, or pending information, which means you need to send us more information in order to verify your coverage, or pending review. This case happens when you have submitted additional reference information and we're pending review, or if you haven't submitted it, you will also get an email reminder. It is very important that students check their SCU emails consistently throughout the summer, because we consistently send these types of reminders in order to submit or waive an important deadlines, not just our office, but other offices across campus. So it's a good habit for these students to regularly check their SCU emails once they've gotten them, at least twice a week, to make sure they don't miss out on any important deadlines. Again, to go back to the second line in this slide, the health insurance waiver must be approved in order for the health insurance charge to be reversed off your student account, your SCU student account. So if the waiver is not approved, you say, hey, I submitted my waiver, but my charge hasn't been approved. Check if your student got the email from Gallagher that states that their 2023-2024 waiver was approved. If they haven't gotten that email, the waiver is not approved. Next slide, please. So some important key deadlines that are coming up. As mentioned, the majority of you have probably gotten notification that you got a billing statement for the fall quarter. So all those items on there, including the health insurance, payment is due for that on August 21st, which means if the credit, and it shows by August 21st, this line basically says, if you haven't made financial arrangements to cover the health insurance charge at that point, then you will need to pay for the health insurance. If you do not pay for the health insurance, then a late fee will be applied to your account, and a hold will be also placed on your student account until you make that payment. The final deadline in which you can submit the health insurance is going to be September 22nd for students. And this is the deadline in which the waiver must be approved. So you want to take account that you might need to provide some additional documentation. So that's the final deadline. And after September 22nd, the health insurance charge will remain on the student account and the charge will not be reversed. So really important that if you have a student and you don't want the health insurance, to submit that waiver, because once you're enrolled in the plan, we can't terminate the plan as well. And dealing with double coverage is, from my experience, what I could tell you in the past, is really complicated, and it could affect your claims, and it could affect your co-pays and whatnot with receiving healthcare. So if you have any questions or concerns, if you're not able to access the waiver, you have something looks odd, feel free to reach out to me at my phone number and email. I'm more than happy to assist you. If you have any questions at all about opting into the health insurance plan as well, we will go on to that slide next. So we are pleased to announce that we were going to be with Aetna for this upcoming academic year. We were previously with Anthem, but now we will be moving to Aetna. We have a PPO plan with them. The annual premium is going to be $3,033, and the coverage period will be for September 15th of this year till September 14th of next year. It is for 1 full year. It is for 1 full year, so it covers them also when they go home, pending that you guys go with an in-network provider. The deductible is going to be $500, which is pretty good, and the out-of-pocket maximum is $8,700. So by me, I'm speaking all, and those are all for that deductible. That out-of-pocket maximum is for in-network services. It will be different if you get out-of-network services, and it will also be $20 copay to meet your primary care or urgent care facility, and it will be $40 to see a specialist. And everything else that requires a co-insurance after you've met the deductible with an in-network provider will be covered by the health insurance will cover 80%, and the subscriber will have to cover 20%. Next slide, please. I believe that's it. Thank you.
Thank you, Tammy. If you haven't already done so, Tammy, could you please put your direct line and your email address in the chat? Thank you. Now we are moving on to CAPS, or Counseling and Psychological Services. We are a team of licensed therapists, graduate level psychological trainees, and mental health professionals dedicated to promoting students' well-being through short-term therapy, crisis support, groups and workshops, and more. At CAPS, we are committed to the values of multiculturalism and social justice, and are dedicated to providing mental health services that are open to and accepting of every student we serve. Come as you are welcome here. These are some of our CAPS staff members, our director, our admin assistant, Tammy, who you got to meet today, our insurance coordinator, Jessica is our case manager. These are some of our staff psychologists and therapists in residence. These are more of our staff psychologists, training directors, and therapists in residence. Our training director, and then some new master's level trainees that are onboarding as we speak. And then our pre-doctoral interns and postdoctoral fellows. So what does CAPS offer? We have short-term ways to keep our students balanced. So on campus, we provide individual therapy, couples counseling, different programs and events based on student need, in-person crisis appointments that can be claimed the same day, T-chats, which are a bit more informal, and workshops. If a student is calling CAPS 24/7, they have access to virtual individual therapy, different therapeutic groups, crisis line appointments, and referrals to in-person providers that would be off campus. Through our one-on-one case management, we can connect students to resources both on and off campus. So maybe a student would be a better fit for a group. Jessica would connect them with that group. Maybe if they need to be connected with being assessed for ADHD, she would connect them with someone off campus to do that. Support with navigating health insurance, linking to off-campus psychological assessments, and there's no session limit for that. And our weekly group therapy on campus, We have all of these different groups that you see listed here, from body liberation to understanding yourself and others, SCQ at SCU, and there's no session limit there either. I'd also like to highlight that for CAPS on campus, while we offer short-term services, there's technically no session limit for that either. So we have some students that maybe just need a session or two, some that might need a handful of sessions, and some that may come in for a double-digit number of sessions. It's really just based on student need and up to them and their therapists to decide what would be the best fit for them in terms of support. How do students access CAPS services? So if a student is looking for therapy, they have one of two routes that they can go. They can call CAPS directly and go through a phone consultation, and it will be determined whether they need a therapy session, case management if more support's needed, or CAPS 24/7. Or if they don't want to maybe talk to someone directly on campus, they can call CAPS 24/7, which is quite literally available 24 hours a day, 7 days a week, and they will be connected with the licensed therapist to determine whether they need ongoing therapy sessions or a referral. For students who are dealing with the crisis, there are two different routes. If it's during business hours, they could just call CAPS directly and be connected with the crisis appointment. If more support is needed, then we would have someone from our center assist them in going to an emergency room or a case management appointment or therapy sessions or a referral. If it's after business hours, then they would call that CAPS 24/7 number, have a crisis call, and then go through the same protocol. This is Jessica, our case manager. She is available to support students in connecting with the following resources: referrals to weekly therapy off campus, referrals for ADHD or other assessments, referrals to higher level of care for more significant issues, such as chronic suicidal ideation, substance abuse, eating disorders, or psychosis. These are our therapists in residence. We have Clarice, who's a licensed social worker. Melba is a licensed marriage and family therapist. She's also an alum. And then I'm an associate marriage and family therapist. This is an extension of CAPS. This past school year was our first year having therapists in residence on campus. And we provide walk-in appointments in student residence halls that can be claimed the same day or the next day, short-term therapy within CAPS or the Cowell Center, mental health support for our residence life student staff members. So at our school, we call them community facilitators, but the RAs, they're working within the residence halls. We offer mental health support to them directly since they respond to a variety of different types of crises. And then we offer outreach events and programming here on campus. That could be anything from a mental health program on the importance of sleep, to a yoga program, to a program about the 5 love languages, and just ways to get our residents engaged in talking more about mental health and reducing that stigma. We have crisis services Monday through Friday from 10 to 3. All of these sessions are 30 minutes and they can be done over the phone or in person to address something that is immediate but non-emergent. Usually these are available the same day, but if maybe those hours do not work for the student that's in crises, they can call CAPS 24/7 any hour at any time. And they can also use campus safety as a resource as well. They can call or text 988 to be connected to trained counselors that are part of the National Suicide Prevention Lifeline Network. And those counselors would provide support and connect callers to additional resources if needed. CAPS 24/7 is a free service for all of our SCU students, and it's staffed by licensed therapists. And so whether they are on campus at Santa Clara or not, if they are a Santa Clara student, they're able to access these offerings. So virtual individual therapy by licensed therapists, referrals to in-person providers off campus, different therapy groups, a crisis hotline, online access to Silver Cloud, which is a mental health app, free access to the Headspace app, and access to students located on campus, out of state or abroad. So we have had some of our students that are studying abroad access CAPS 24/7, and they found it to be incredibly useful. In terms of consultation and confidentiality, all of our student interactions with CAPS are strictly confidential. with legally mandated exceptions for risk of suicide, homicide, or disclosures related to child abuse or abuse and neglect. However, if a student gives us permission by signing a release of information form, CAP staff can consult with other faculty, staff members, off-campus providers, or parents in order to be sure that we're able to better meet the student's needs. If you're a concerned parent, and maybe you haven't been able to get in touch with your student, you can always request a wellness check from one of the offices listed below, and they will be happy to assist you with that. All incoming first year and transfer students are required to complete at-risk mental health training sometime between August 12th and September 12th. So as Tammy mentioned earlier, it's going to be very important that they are checking those emails. SCU partners with Cognito to offer a brief 40-minute online course. This interactive experience is going to equip students with skills to support their own mental health and that of their peers. It introduces positive coping strategies and prepare students to recognize signs of distress and effectively communicate their concerns to be able to find better support. More information can be found at the link listed. And that is it for our presentation for today. We do care about you, and our top priority is students' physical, mental, and spiritual health. If you have any general questions that you don't want to ask here, you can always email us at cowellcenter@scu.edu. And to the left are all of our phone numbers and our building location. I'm going to stop the screen sharing